Hello, welcome to my frequently asked questions. Today I'm answering a commonly asked question about rhinoplasty and consent. This is a very important aspect of modern day medicine, and so today we're going to be looking at what is consent for rhinoplasty. Consent, well, what is it? It's a process by which you can understand exactly what the procedure involves, understand what the potential expectations for improvement, what are the potential limitations, what is the recovery from the procedure, and of course what the potential risks and complications are. So modern day consent, what's a very important aspect of rhinoplasty, and it's important that it's an informed decision, and by that it means that you personally understand what the procedure is, what you're undergoing, and what the recovery is. You understand what the expectations for improvement are and what the limitations are. Are there alternatives to having surgery? If so, it's important that they're discussed with you. What is the recovery after rhinoplasty? What are the potential risks and complications with rhinoplasty? And how they are specifically important for you. It's important that your GP is informed, confidentiality aspects to the surgery, and that you have an adequate time in order to understand these principles. And finally, it's important that you feel you have had enough information, and it is within your right to ask further questions, ask for a second appointment and second discussion about the procedure if you feel it's important that you need more information. So my name is Dr. Julian Silva. I'm an oculofacial plastic surgeon based in London, and this is surgery that I do every day for my patients. And of course, this video, well, it's really for information and education purposes, and it cannot construe a consultation. Well, what does it mean to have informed decision for rhinoplasty? Well, it's important that you understand what the procedure is, that you understand what the potential benefits of the surgery are, what the expectations for improvement are, but also you understand what those potential risks and complications are as well. It's important that you feel free to ask as many questions that you feel are important. You can change your mind at any time. And although, generally speaking, most patients having rhinoplasty have a pretty smooth journey, well, it's important to realize that it is surgery and no procedure has no risk. So finally, well, what is rhinoplasty? Well, in terms of rhinoplasty, well, we're talking about surgery to the nose, and we're often improving and changing the shape of your nose. Sometimes there can be aspects of breathing that we want to improve or maintain. There may be a history of previous trauma or surgery or scarring to the nose, and it's important that all of these are taken into account. What is our objective? Well, generally speaking, our objective is to give you a more balanced and harmonious nose, one that just is in proportion to your face and just looks natural. And often breathing is an important component of this, because not only do we want it to look good, but we also want you to breathe well. So in terms of rhinoplasty, what does this actually mean? Well, often we are making the nose smaller, and that often means removing parts of the underlying anatomy. And that might be the hump, because the shape of the bridge of the nose, and improving the profile of the nose. It might be in terms of the tip being too large, or sometimes that's called bulbous, and improving the shape of the tip by refining the cartilage, shaping the underlying anatomy. Sometimes in some patients, particularly in ethnic rhinoplasty, well, that might be adding graft material to give more definition to the nose. Sometimes there can be aspects of drooping, particularly with smiling, the tip droops down, and then the nose can require adequate support, and often that means some degree of grafting in order to support the nose so it doesn't dip in the same way. And commonly I will use graft material from within the nose, the septum, in order to give the best results, but sometimes it can require other types of graft material. And other types of graft material, in addition to taking it from the septum, well, you can take graft material from your ear, and that can be particularly helpful in revision rhinoplasty, or if there's a lot of weakness around the tip of your nose, because the curved shape of your ear can very well maintain the shape of your nose and nostrils. And of course, your ear is unchanged by this surgery. There is a scar at the very back of the ear in order to get the cartilage, but it doesn't change your shape of your ear in any way. Sometimes cartilage is required from other sources, and that can be like from the rib cage, and that can be another procedure in itself in order to take that cartilage. Or it can be taken from cadaver cartilage, and that can have the benefits of not needing another surgery. However, there is often more demand for that type of cartilage than there is supply. And sometimes other types of graft material can be used, and that includes MedPore, includes silicone, and of course the type of graft material needs to be tailored to your individual needs, and of course your surgeon will discuss those graft material options for you. And in a way, there's no one or single graft material that is perfect for every patient. It really depends on multiple factors. For example, your ethnicity, the thickness of your skin, all of these things have very important factors in choosing the best graft material for you. And often rhinoplasty is regarded as the most challenging cosmetic or plastic surgery procedure because of the level of detail that's involved in improving the nose. Often they require shaping of the underlying bones, shaping of the septum, and there's a degree of artistry with rhinoplasty in that some parts of the nose, well, it can be measured to a millimeter. The cartilage in the tip of the nose can be literally refined to a 0.5 millimeter measurement. However, there are degrees of artistry in that there's parts of the nose that no measurement can define the best result. Really, it's a degree of artistic impression, what you desire as a patient, and your surgeon's ability to take that expectation and refine your nose in an artistic way to give you the best result. So often rhinoplasty will involve a number of these factors: removing a certain amount of anatomy and graft tissue, lifting areas that have become droopy, adding graft material to specific areas, and of course shaping the underlying anatomy. And underlying this, well, we want you to breathe well after rhinoplasty, so there may be straightening of the underlying septum. There may be elements of using graft material to enhance breathing and support narrow areas of the nose. And of course, the techniques that are used need to be tailored to you. And there's open techniques, which means a small scar at the very undersurface of the nose. There's closed techniques where the surgery can be hidden within the nose, which can be suitable for some patients. Septoplasty within the nose, well, sometimes that can be a very important aspect of straightening the nose to give a straight nose, and also using graft material to support the nose. And of course, anesthetic is also important, and most rhinoplasty, and certainly in the UK, is done under gel anesthetic, which is absolutely fine. However, my preference is to use sedation or twilight anesthesia, which is more used in the US, as patients tend to recover over half an hour and patients can go home less than an hour after surgery. So this is one of my patients where, well, let's have a look at the different aspects of their nose. And they have a high or large hump on the bridge of the nose, and the nose is just that little bit too large or over projected. In terms of the position of the tip, well, it just droops very slightly, and when this patient smiled, it drooped further down, and there were breathing issues as well. So in a way, each of these aspects has been required for this patient: removing the hump, shaving down the underlying anatomy, the bone and the cartilage, reducing the projection of the nose, which ultimately means making the nose smaller. Drooping, well, that required graft material from the septum in order to support the very base of the nose, straightening the septum in order to improve the breathing. And of course, there's a degree of artistry with this to give a nose that's in balance and in harmony with this patient's face. An open technique was required in order to shape the underlying asymmetry, and septoplasty was required in order to ensure adequate breathing and opening of the airway, and this patient had surgery under sedation anesthetic. Another one of my patients, and this patient, well, he had like a hump on the bridge of the nose, and this required refinement with removing some of the underlying bone and cartilage to improve the shape. A masculine shape is often straighter, which gives a more masculine appearance to the nose. Graft material was used in order to support the airway and make sure this patient breathed well after surgery. And an open technique is often my preference for ethnic rhinoplasty because it enables you to give more definition in the nasal tip, which is often quite desirable as it creates a more refined appearance. And this patient also had surgery under sedation anesthesia or twilight anesthesia. For some patients undergoing rhinoplasty, well, accessory procedures can also aid the overall result. If you have quite a receding or small chin, well, a chin implant or improved chin projection can really rebalance the facial harmony and give the best results. For some of my patients, well, I will use rhinoplasty in conjunction with eyelid surgery, also known as blepharoplasty, or face and neck lift surgery in order to give an overall enhanced appearance and harmony. And of course, there are other techniques such as laser resurfacing to the skin, radiofrequency to tighten the skin, adding volume in terms of fat transfer, and the use of regenerative medicine such as platelet-rich plasma, which can all improve these kind of aspects. And this is one of my patients who had a recessed chin, and you can see by bringing the chin forwards in combination with refining the neck has really resulted in improved appearance in this patient. Now, in terms of other procedures, well, sometimes brow procedures, lifting the brow can be important with rhinoplasty. However, each patient surgery needs to be customized to what you personally notice to give you the best results. What about expectations? Well, expectations are always around improvement, and improvement means, well, in a way, you're not made out of clay, so improvement means refining your natural anatomy to give you the best results. And often this improves the structure of your nose, but function in terms of breathing is also very important. And often this requires procedures such as septoplasty or certain graft material to give the best function in breathing after rhinoplasty. What are the limitations of rhinoplasty? Well, it's not necessarily going to change how you feel. It's not necessarily going to change your relationships or your level of confidence. Now, for some patients having rhinoplasty, well, the surgery can be life-changing. However, no doctor or surgeon could promise you that undergoing a procedure is going to change these specific aspects, because some of these feelings, such as confidence, have to come from within. And it's important that you discuss what your expectations are from surgery sincerely, as some things will definitely be improved, but some things are difficult to promise by rhinoplasty alone. What about expectations? Well, if you're made out of clay, we could move every part of your nose in every way possible, and we could make your nose perfect. However, as you're not like a living sculpture, we can only change the underlying anatomy by shaping and refining and modifying your own anatomy. And so generally, we're talking about an improvement. And improvement, well, it may be 70 to 80% of the way towards what the ideal result is. If you've had previous trauma or previous surgery, well, there's scarring in your natural nose, and there are limitations, and it may be that your nose can only improve 50 or 60%. And of course, this needs to be tailored to what you individually notice and discuss with your surgeon. You are a very important component of rhinoplasty consent. It's very important that you discuss your profession, your lifestyle, any hobbies that you have, because the consent process needs to be tailored to you, the individual. If you've had any serious life events in the recent period, it's important to discuss those with your surgeon so he or she can take them into account in order to give you the best guidance regarding timing of surgery. As it's never a good idea to have a procedure when you've had a recent traumatic or significant lifestyle event, as this can really give you a roller coaster of recovery. In terms of your health, it's very important that you stop smoking, because this can significantly affect healing from rhinoplasty. If you have any recreational drug habits, and by that I mean or include cocaine, it's very important that you discuss that with your surgeon because that can have implications for healing and the results from surgery. It's important that you drink water, you hydrate yourself after surgery. It's important that you have sleep and rest that allow time to recover. And in terms of exercise, I generally advise my patients to have 3 weeks off kind of exercise to allow you to heal the fastest and reduce swelling after surgery and speed up the healing and recovery process. Are there alternatives to rhinoplasty? Well, for some patients, the use of fillers, more rarely Botox, can really add great refinement to the nose. This is a patient of mine where I used fillers really to disguise the underlying curvature and hump in the nose to give a more refined appearance. However, non-surgical treatments and fillers do have limitations, and so they will not benefit all patients. Now, in terms of recovery after rhinoplasty, well, it does depend on the type of surgery that's involved, the type of anesthetics that is used, and personal individual factors, your age, your genetics, environmental factors. All of these can implicate recovery. But common things are swelling. About 10 to 20% of my patients can have some bruising, and most of that will go in 2 weeks. There's always some degree of numbness, particularly around the tip of the nose, and that improves over a period of months. And often in the early healing period, there is asymmetry because the swelling is not even. There can be swelling more on the right side, on the left side, and that tends to exaggerate asymmetries and cause things like nostril asymmetry. But as that swelling goes down, these things will absolutely improve. So the common things in terms of like recovery are swelling and bruising, and of course these things improve over a period of weeks. And most of my patients advise you really need 2 weeks where you have those social or professional engagements to give time for recovery. If you have a really important social event such as a birthday or a wedding, well, I'd really encourage you to have even 6 weeks to allow plenty of time for recovery. Sometimes there can be some irregularity and asymmetry with healing. There can be a degree of congestion because of swelling within the nose. And sometimes because of swelling in the upper lip area, that can affect the fine, delicate smiling. But by 6 weeks, this will have improved. And of course, expectations for surgery are important. All of these factors are really about an improvement. It's very hard to achieve true perfection. Now, in patients, particularly with thinner skin, there can be tiny irregularity when all of the swelling has disappeared. And that's because thin skin doesn't hide even the tiniest detail. And in less than 5% of patients, sometimes a tiny amount of filler can just make the whole nose smoother and more even and avoid any further need for surgery. Although scars generally heal very well, there's a less than 1% chance of an issue with scars that might require further laser treatment or refinement, but generally scars with rhinoplasty heal very well. In terms of serious risks, well, collapse of the nose, necrosis, Csf leak, these are very rare risk factors. However, collapse of the nose, if you're using cocaine or there are other factors or medical factors with your nose, it's very important you discuss these with your surgeon. Smoking, well, really it's very important to stop smoking before and after surgery to minimize healing issues, and necrosis would be where inadequate amount of oxygen is going to the very tip of the nose. Personally, I've not seen this in my patients. However, I have had patients come to see me for issues where they have had issues. And so smoking is a very important factor, particularly with rhinoplasty and revision rhinoplasty. Csf leak, well, I've never personally encountered this, but I have had a colleague who's had a number of Csf leaks after rhinoplasty. And so these things would be very rare, but it's important that you have trust with your doctor to look after you during the recovery period should you have any untoward circumstances. Other aspects like infection, very uncommon after rhinoplasty, but the gold standard would be taking antibiotics before and after surgery to give the best results. Pain is not a common factor after rhinoplasty, and although I give every patient several days of analgesia, more than half my patients, they don't use the analgesia, but very Occasionally I'll treat someone who's more sensitive, and if you need to use analgesics, then absolutely do so. Sometimes you can have a longer recovery, and that could be with swelling, that could be just with overall settling and becoming used to your nose. And although most patients recover quickly after rhinoplasty, every so often just things take longer time. And the final result after surgery, well, it can be as long as 12 or even 18 months when the very final result is resulted. What is the need for further surgery? Well, in my hands, less than 5% can require a refinement surgery. What can that mean? Well, if there's a tiny imperfection, such as nostril asymmetry, even though the nostrils have been measured to 1 millimeter, well, sometimes it's necessary to do a little bit more in order to get that very final result. Anesthetic risks, well, it does depend on the type of anesthetic. General anesthetic is generally very safe and widely used in the UK, but rarely it can be associated with serious issues such as allergy or anaphylaxis or a clot in the legs known as DVT. My preference is generally to give patients sedation anesthesia, and the benefits of sedation anesthesia is, well, you recover over about half an hour, and most patients can go home within less than an hour of surgery. However, very occasionally you can have a mild headache, very occasionally you can feel mildly nauseous, but most people have a pretty smooth journey with sedation anesthesia. What about in summary? Well, common things after rhinoplasty are a degree of swelling and occasionally bruising, and of course these things resolve just naturally with time, but any one of these complications can occur. And although the great majority of patients having rhinoplasty have a smooth journey and a fast recovery and very happy, any one of these issues can occur. And so it's very important that you trust your surgeon, you trust the team looking after you. So if there is anything, you can absolutely go back to them and discuss these issues with them. The best practice in the UK is understood to inform your GP of undergoing rhinoplasty. Of course, you have patient confidentiality, and so if you do not wish your GP to inform, then you must tell that to your surgeon. But generally that's regarded as the gold standard because it's regarded important that your GP understands the surgery that you've undergone. In terms of time, well, it's important that you've had adequate time in order to understand the procedure, understand and absorb the information, what the benefits, the limitations, the potential risks are, and so that you feel comfortable in having surgery, and often that's regarded as a period of over 2 weeks. For certainly my patients, undergoing rhinoplasty is usually a significant decision, and most patients have thought about things for many years before coming to that decision. And it's important that you feel you've had enough information in order to make that decision, and you can change your mind. You can ask more information about in any of these aspects, about the expectations from surgery, about the recovery, the potential risks, alternatives to surgery. And if you feel you need further information, you can ask for a second consultation with your surgeon. You can ask for a second opinion. And some of my patients like to speak to a patient who's undergone the surgery in order to feel more comfortable with things. So what are my tips from doing this for many years? Well, it's really important that if you're undergoing rhinoplasty, that you understand what the procedure is. You understand what the implications and expectations for improvement are. You understand what the limitations and the more challenging aspects are. It's important that although most people have a pretty smooth recovery and are really happy with surgery, well, sometimes risks can occur, and sometimes you need to have comfort and a supportive team that are able to look after you during that recovery period. And it's important that you feel you can ask questions and feel comfortable with the team looking after you. And I have many patients come and see me even weeks after having surgery with other surgeons for second opinions and revision surgery. And I really encourage patients to go back to their original surgeon and talk to them in order to get the best results and the best experience from surgery. So in terms of consent, well, these are the things that we've talked about today. What is informed decision regarding rhinoplasty? What you need to understand in terms of the procedure, what the expectations for improvement and what the limitations are, how in some patients an alternative to having surgery may be no treatment at all, or maybe non-surgical treatments such as fillers. What is the recovery? What are the potential risks and complications, and how those are specific to you? In terms of informing your GP, confidentiality, having adequate time to make that decision, and then of course feeling that comfortable and that you have had adequate information, and if necessary ask for more information underlying the rhinoplasty procedure. I hope this information has been useful for you, and if you have any further questions about rhinoplasty consent, please do not hesitate to contact me. Thank you for watching.